My name is Jessica Douglas, and this presentation is for one of my nursing classes at Morehead State University. The presentation is going to summarize my Capstone project, which was a paper that I wrote during the semester. The assignment for the Capstone paper was to identify a nursing or patient care concern, and then to identify one of the quality and safety education and nursing competencies and analyze how it relates to the issue that I identified. When I wrote my paper, it was to examine the importance of the utilization of evidence-based practice in the prevention of ventilator-associated pneumonia. Evidence-based practice is one of the quality and safety education and nursing initiatives. Medical treatment and any kind of nursing implications should be based on best practice, because research reveals that there are several prophylactic strategies for the prevention of ventilator-associated pneumonia. Sometimes there's resistance when using any kind of pre-printed order sets or protocols. Maybe physicians want to implement their own thing, or they don't want to implement what they refer to as this cookie cutter medicine. They want to order their specific components separately as they think the situation calls for. But research has shown that when implemented together, these measures, such as like using a ventilator bundle, reduce the risk of lung infection, and they follow evidence-based recommendations. So that's what I wrote my paper on. The first thing that I did was basically figure out the prevalence of ventilator-associated pneumonia. Anytime that someone has to have an ET tube placed, then it impairs their normal protective mechanisms of their body, which potentially increases the risk of contracting pneumonia by 6 to 20 times the normal. Ventilator-associated pneumonia is reported in 10 to 35 cases per 1,000 ventilator days, and the incidence of VAP complicates the treatment of about 8 to 28% of patients. Contracting such an infection can lead to several negative things for the patient, like increased cost, longer length of stay, ARDS, maybe even death. So it's very important that whenever we can, we put the appropriate measures in place to prevent such an infection from occurring. And there are several things that have been shown to reduce the risk of ventilator-associated pneumonia, and they're implemented with evidence-based practice, which, like I said before, is one of the quality and safety education for nurse competencies. In looking through some of the research and some of the studies that were performed, basically I'm finding that there are 5 best practice initiatives as part of the Institute for Healthcare Improvement's ventilator bundle. This set of interventions include elevation of the head of the bed, definitely greater than 30 degrees, daily sedation interruptions, that way the patient can be assessed for to make sure they're still neurologically intact. They can be assessed for the readiness to extubate, which is another one of them, peptic ulcer disease prophylaxis, and daily oral care with chlorhexidine. Now, sometimes physicians may order some of these things, but they may not necessarily order all of these components. And if you look into any of the studies that are out there, you can see that there is a higher incident of ventilator-associated pneumonia when maybe you just have a couple of these initiatives implemented and not necessarily all of them. Having all of them implemented together greatly reduces the risk of contracting ventilator-associated pneumonia. By keeping the head of the bed elevated up 30 degrees or greater, it reduces the risk of aspiration. You have the patient sitting up higher, their secretions, which, anyone who's taking care of an intubated patient knows that they typically have excessive salivation because that ventilator or the ET tube kind of impairs their normal swallow and gag mechanism. So if you have their head of the bed elevated, then those secretions aren't going to drain into the lungs as easily. Doing the daily sedation interruptions, like I said earlier, you can assess for the readiness to wean and to extubate. You don't want to have the patient on the ventilator any longer than they absolutely have to, because every day that they're on the ventilator just increases their chances of contracting some kind of an infection. So we want to get them extubated as soon as we can. Peptic ulcer disease prophylaxis was another component of the bundle. When a patient has excessive gastric secretions, sometimes they can be coughed up and then aspirated back into the lung. and then that can set up a pneumonia. So we want to make sure that we keep that level of stomach acidity down to a minimum. That way we reduce the chance of the patient actually coughing and aspirating on stomach contents. And then daily oral care with chlorhexidine. Usually there's the little prepackaged kits with the swabs and the solution that are in the packages for us to perform the mouth care. Some of the studies that I looked at, the patients were receiving mouth care, but they weren't receiving it with an appropriate chlorhexidine solution. And in studies, this is shown to be the best solution to use when doing mouth care for ventilator-associated pneumonia prevention. We want to make sure we're doing the oral care at least every 2 hours, and make sure we're suctioning any secretions out of the mouth that might travel into the lungs, which we know that the mouth is full of bacteria, so any secretions are going to harbor that bacteria, and if that gets into the lung, then that predisposes them for any kind of infection. So basically, when I was doing this project, and I was doing all this research and seeing all of these recommended interventions, I noticed just that we as nurses, we try to do what's right, and we usually try to follow all the protocols, but sometimes you may get busy, or there might be that one time that you're a little bit late doing that oral care. And looking at these studies, it really shows that following this to a T and making sure we implement every component of this ventilator-associated pneumonia prevention bundle is really the key to make sure that our patients don't contract ventilator-associated pneumonia. So all of these things have been proven to work through research studies. They are proven as best practice guidelines, and they really should be implemented. The physicians need to implement these protocols that are based on these best practice studies, and then we as nurses need to make sure that we follow them for the better of our patients, to make sure that we're providing that quality care that we would want our loved ones to have.